hypotension, like very commonly used medications. But again, what other indication you can use the sympathomimetic drugs, right? It can affect, so when you know the SNS does three things, cardiovascular, lungs, and liver, so now you can kind of get an idea of the sympathomimetic drugs affecting those systems, right? That we're gonna further talk about those receptors that related to SNS system. Again, this is cardiovascular, so we have parasympathetic nerves that we just said slow down the heart, and then we have sympathetic nervous system or nerve that increasing the activity of the heart. So it's kind of para and the sim, they are opposite of each other when it goes to the cardiovascular system. I'm just going to get to this one. Now, from now on, we don't use adrenergic. It's kind of replace SNS. Whenever we want to say sympathetic nervous system is adrenergic. So the receptors that are associated with SNS, they call them adrenergic receptors. And the receptor that related to the parasympathetic nervous system, they call them cholinergic. Again, as you can see, cholinergic mediated with acetylcholine is a neurotransmitter, and adrenergic neurotransmitter is what? Epi and norepi, right? Again, adrenergic is the same as SNS. The receptor called adrenergic receptors are the receptor that epinephrine and norepinephrine bind. Right? So one thing, again, is not maybe extra information. Again, medication, you probably heard anticholinergic side effects. Yeah. Medications, they have very common anticholinergic side effects, right? Depressive medication, antidepressant, antipsychotic, bipolar, some of them, they might have anticholinergic side effect. So what kind of side effect you expect to see when we say anticholinergic side effect?
Upgrading the sympathetic expressions.
But do you remember what was the cholinergic effect? Rest and digest, right?
Yeah.
Cholinergic does rest and digest. What was the rest and digest? Power. No, but what was the on that PowerPoint slide? Empty the bladder.
Increase gastrointestinal activity.
Right, secretions. Empty the bladder, empty the bowel.
Yeah.
Right, increase the digestive enzyme, slow down the heart. So when you use when the anticholinergic side effects means those cholinergic become opposite, right? Heart rate goes up. Dry mouth is very common anticholinergic side effect, and very common and problematic. So many of these medication, when they are anticholinergic, they dry the mouth, or they ask them to put the candy on whatever, but on the bladder, so urinary retention, right? Constipation. So these become, now that you know the cholinergic, anticholinergic means reverse of those function. Make sense?
Yeah.
Just again, because it become helpful when you answer the question on exam. Not for mine, but for the site prep. So now just a picture of peripheral nervous system, right? PNS. So it's going to divide to cholinergic and adrenergic. Cholinergic, we're going to skip. We're going to focus on adrenergic. So we have alpha and the beta receptors. So alpha 1, alpha 2, beta 1 and beta 2. So again, they are 1 and 2 because they are alpha receptors, but they have a different functionality. They work different from each other. Beta 1 and beta 2 the same. They have a different function, even though they are beta receptors. That's why they divide them to beta 1 and beta 2, because when they give them medication, they realize, oh, if you block the beta 1, you're going to get different response than when you block beta 2. Different things happens. Make sense?
Yeah.
But that's the adrenergic receptors. So now, where is the alpha 1 located? So where you find the alpha 1 receptor?
The vessels.
Vessels. Right? So they are in bladder, prostate, and other places, but we skip that part. So vasoconstrictions happen when we have alpha 1 agonist, right? So the alpha 1 agonist does what?
Makes activity.
So alpha 1, so again, where are the alpha 1 receptors? They are in artery and the veins, right? Venous system and arterial system. So when we activate, when we use the alpha 1 agonist, what's going to happen? So vasoconstriction, right? So if you do the vasoconstriction, what happened to blood pressure? So, okay. And then we also have alpha 1 antagonist. Again, another name for the antagonist is the blocker. So what happens when we do alpha 1 antagonist? Opposite, right? Again, antagonists work when we have agonists, right? Remember that, right? So, antagonist, vasodilation. And vasodilation, what does to the blood pressure? It decreases, right? So now you realize, oh, alpha 1 blocker or antagonist is antihypertensive meds. We're going to talk about that in a couple of weeks. Right? Alpha 1 blocker is an antihypertensive medication. Why? Because it's causing vasodilation and drops blood pressure.
And that one's bound to by epinephrine or norepinephrine or both?
Both. But again, norepinephrine is mainly on the vessels, and norepinephrine on the vessels, epinephrine on the heart. Working on those. So now we have, where is alpha 2? Where do you find alpha 2 receptors? It's in brain, right? So this is on the vessels, and this one is in brain. So this is the central adrenergic receptor. They call it central because it's not in the peripheral systems. Only is in brain. And so we only have alpha 2 agonist. There is no antagonist. So on exam, I'm going to ask alpha 2 antagonist. Just a trick. There is no. The answer is no antagonist. But even the agonist now is going to have a little confusion here. What happens if we activate alpha 2 receptors? What happens?
A lot of signals in the
Yeah, but what alpha 2 receptor does? Agonist, activation of alpha 2. Decrease the norepinephrine release in brain. So again, this is another example of agonists that is slow down because they are inhibitory receptors. Alpha 2 agonists, they decrease the amount of norepinephrine, right? Make sense? And if we decrease the norepinephrine, what's going to happen? What was the effect of the norepinephrine? Vasoconstriction from stress lecture, right? So now that norepinephrine drops, we're going to have less vasoconstrictions, which means what? Vasodilation, right? Make sense? So now activate alpha 2, norepinephrine drops, I get vasodilation. And that's what happened to blood pressure? Decrease, right? I know this doesn't let you to see this. Okay. Alpha 1 agonist, blood pressure go up. Alpha 2 agonist, blood pressure go down. That's why we have alpha 1 and alpha 2, right? They're completely opposite of each other. How about beta 1? Where is the beta 1? So the beta 1 is only in heart, cardiac system. And what happens, so we have agonist and antagonist. What happens if we activate the beta 1, if we give him the beta 1 agonist?
More contractions.
So beta 1, again, what SNS does to heart? Right? The beta 1 is the part of the SNS. This is an adrenergic receptor, right? This is SNS receptor. So beta 1 agonist is going to increase the heart rate and increase the contraction. These are the two things that the beta 1 agonist does. So increase the heart rate and increase the contraction, right? If you do that, what happens to the blood pressure? Goes up. Now, knowing the agonist, the response to the antagonist is easy, right? What antagonist does? No, but before the blood pressure. So antagonist is blocking the beta 1 receptors. Make sense? So that means now if you use the beta 1 antagonist, they call it beta 1 blocker. Or have you heard beta blockers?
Yes.
So this is the, yes, atenolol. So beta blockers, we meant beta 1 blockers when we say for this antihypertensive. So if you use that antagonist or blocker, what's it's going to do? Decrease heart rate, opposite of what agonist does, right? And decrease contraction, which decrease the blood pressure. Make sense?
Yeah.
So now, if the beta 1 agonist, blood pressure goes up, right? Again, what is the beta 1 agonist? Epinephrine. So they give a shot of epinephrine, right? IV epinephrine drips when the person is in shock, right? This is the treatment. Blood pressure goes up. When the patient is hypertensive, what they do? Beta blockers, beta 1, sorry. Beta 1 antagonist or blocker. Why? Because they want to drop the heart rate and contraction and decrease the blood pressure. So now you realize, okay, now we're going through several, let me put here. So we have alpha 1 antagonist, blood pressure, antihypertensive medication. Alpha 2 agonist, antihypertensive. Beta 1 blocker or antagonist, antihypertensive, right? You see that we have several categories of the antihypertensive medications. Now we're moving to the beta 2. Where is the beta 2 located at? Uterus, lungs, liver, right? Does beta 2 have anything with blood pressure? No. This is the only adrenergic receptor does have nothing with the blood pressure, right? So it's part of adrenergic receptor, but it does not have anything with blood pressure. So again, we have beta 2 agonist, and we have beta 2 antagonist, the same as. So the only receptor doesn't have antagonist is this alpha 2. Any other adrenergic receptor, they have agonist, antagonist, right? The only one that is unusual or specific is alpha 2, only have agonist. So now the beta 2 agonist, what's going to happen? So if we give them beta 2 agonist, so we know that it's happening, it is located in 3 systems. In lungs, is do what? So open up the lungs, right? And then 2, number 2. Where is the other 2? Liver. What it does in the liver? Beta 2 agonist. Glycogenolysis and gluconeogenesis, right? So that you need to remember on exam is question glycogenolysis right? So when we do that, what's going to happen? Blood glucose. Right? So again, beta 2 agonists in liver, right? You activate them, glycogenolysis, gluconeogenesis is going to go up. That means blood glucose is going to go up. That means liver is going to produce sugar, right? Make sense? And the third one is the uterus. And so the uterus is not significant unless the person is pregnant. If you're not pregnant, the third one is not significant for the beta 2 agonist, right? But if the person is pregnant, what's going to happen? What beta 2 agonist does to the uterus? Relax the uterus, right? Is that a thing? Is that a medication? When we use the beta 2 agonist during pregnancy, early labor. We heard early labor, like week 15, they have contraction. No. Give them beta 2 agonist because you want to relax the uterus. It's not time yet. Okay? That's become a medication.
Beta 2 agonist for early labor?
No, yes, because beta 2 agonist is relaxing uterus, right? If the person is pregnant and they have contraction early, you give them beta 2 agonist because you don't want pregnancy to end that quick. And vice versa, the antagonist, beta 2 antagonist. What's going to happen with beta 2 antagonist?
Bronchoconstriction.
So blood sugar goes down, the lungs are going to be constricted, the uterus is going to have contraction. So if the person is pregnant, can you give them beta blocker? No. Why? Because you're inducing the labor.
Wait, so beta blockers include both beta 1 and beta 2 receptors?
So the beta blockers, we're going to talk about more. They have selective, non-selective, non-selectively bind to both. But again, so if that's the case now, if the person is pregnant, beta blockers become contraindication, right? Because you don't want to cause the labor.
Is Pitocin then a beta 2?
No, that's a different, it's coming from, it's a whole different. But anyhow, so what else? With the lungs, right? Again, so that's, the beta blockers has become a problem when you have a condition. Like if the patient has diabetes, right? What's the beta blockers is going to do? Beta 2 blockers. Drop the blood sugar, right? So that's not a good idea. Or beta 2 agonists is going to increase the blood glucose. So we're going to talk about those in detail later on. But again, as far as this receptor goes, so we're good. I mean, it's a little messy board. But again, draw this when you go home. Like what you need to do is you draw these receptors. You want to make sure you understand all alpha 1, alpha 2, beta 1, and beta 2, right? What agonist does, what antagonist does, which one is, like again, beta 2 is not involved in blood pressure at all, right? But when we use the antihypertensive, beta 2 becomes side effect of it. Like beta blockers, they have side effects because of beta 2. Beta 2 doesn't do anything with the blood pressure control, but it can cause the side effects of those medications. But again, as far as exam goes, I'm going to play with this receptor a lot. That means you need, if you confuse a little you're gonna lose all the questions. Right? It's gonna cost you.
I was going to ask a question. While you have this on the board, what's another example of a question that you might ask?
Oh yeah, I'll give you a question example.
Like right now.
Yeah, right now.
What is the question?
So an exam is going to be like this. So which option cause decrease in blood pressure? 1. Alpha 1 blocker. Alpha 2 blocker. Beta 2 blocker. Alpha 1 agonist. Alpha 2 agonist. Beta 1 agonist. Again, so I'm not going to complete the whole thing, but to give you an idea. So that's going to be examples, right? So now you have to make sure you understand each of these receptors that they cause the decrease in blood pressure, right? And then sometimes I put alpha 2 antagonist, right? Every option is correct, but there is no alpha 2 antagonist. So I just drop it to see. And you pick that and it's incorrect because there is no alpha 2 antagonist. Make sense? But that's the one version of the questions. Another version of the question is patient comes with early labor. What are you gonna do? Which of these medication question? Alpha 1 blocker, beta 2 blocker, beta 1 blocker. But I'm just saying, question is all around these receptors, right? So again, if you know the receptors, so you're gonna answer. If not, especially this one that is combination, right? It's gonna be several receptors in one choice. And again, it's hard. Like, let's see, complete this one, right? So just the option that I have. Alpha 1 blockers, does it decrease the blood pressure? Yes. Alpha 2 blockers, there is no alpha 2 blockers, right? So that's not the choice. Alpha 1 agonist, does it decrease the blood pressure? No. How about the alpha 2 agonist? Yes. Beta 1 agonist? No. And then, so let's make it the third one. Alpha 1 block. Alpha 2 agonist. Right, this choice again. Alpha 1 blocker, decrease the blood pressure? Yes. Alpha 2 agonist, decrease the blood pressure? Yes. Alpha beta 1 block, decrease the blood pressure? Yes, right? So that's the correct answer. But again, in order to answer that question, you need to know all the receptors, right? And if you mix them up, so you make it really hard because now you have to go back and forth. It's lots of information, right? Back and forth to, at the end, you're gonna guess. So it's very important because again, receptor that we have, the reason that we go in detail because this is gonna transfer to week 9 or 10 when we do the cardiovascular. Because now we're gonna, this information, now we're gonna put name on it. Alpha 1 blocker, what is called? Beta 1 blocker. You're gonna hear the name of the medications. But when you have this foundation, now it's easier to plug in the meds, right? Like what is the alpha 1 blockers? Trazocin, like those minitres. This is the one. Like what is the alpha 2 agonist? Clonidine, methyl-dopa, right? What is the beta 1 blocker? Propranolol, atenolol. Make sense? At this point, the name obviously is not important as this one, right? But when we go to the cardiovascular lecture, when I talk about beta blockers, I'm not, so if you don't know it, like if you know this, again, now when we talk about atenolol, you're just getting it, right? Because you know what atenolol does, right? What atenolol does is decrease the heart rate, decrease the contractility. Why? Because it's the beta 1 blocker. Make sense? So then my point is this information for exam 1, but you have to hold on to it. Some others you can forget. But this you need for exam 3. Make sense? On exam 3, you need this information again. So make sure you don't forget that quick. Just keep it around for another couple of weeks. But that's the idea around this receptors. Question? So next week we're gonna have the exam 1, right? So there is a TA review sessions whenever Cassidy posts it, right? Make sure to go to that. If it's not, so she's gonna record it. So when you go to that review session, just make sure you study beforehand. At least you can ask her question. Don't go again like just in and out. So it makes more productive process if you ask question, right? Because it's a couple of days before exam. So for exam, again, we meet in computer lab in Prato building. You know where is the health assessment lab? So the 1 floor down from the health assessment lab. The same building?
What room number?
Is L850.
L850.
So that's the computer room.
Okay.
So again, make sure you have, not make sure, but I mean, if you bring, sometimes the PC doesn't work, so if you bring your laptop as an alternate, so you can use your laptop if the computer doesn't work. But again, make sure you have lockdown browser download on your laptop, right? So you can, I mean, you have a choice of using your computer or the computer lab. But that's gonna happen. So you take exam at the same time that you have class. That means you start at 1, and whenever you finish, you go home. There is no lecture after exam. And then there is gonna be a practice exam also, give you idea as far as what question look like if you take that practice exam. Just make sure you answer the study guide, like you want to make sure you answer every single one. Study guide is based on what's going to be an exam. But again, any question is going to be based on what we talk in class. Right? Just that's the main part of the exam.
Okay.
All right. We finished early.